Good day, everyone. I am Danee Cordero, a student midwife of Occidental Mindoro State College. Today, I will be performing essential newborn care. So before we proceed with the demonstration, let me say first the purposes of essential newborn care. First, to provide initial care to the newborn. The second one is to reduce newborn mortality. So before we can assess the labor and delivery, we need to prepare all the necessary supplies.
We need 2 sets of sterile gloves, 2 clumps, 1 scissor, gauze, 2 pieces 1 cc syringe, and we also need oxytocin, vitamin K, and erythromycin.
Second, perform hand washing and double gloving. After we have done with our gloves, we can now proceed in assisting in labor and delivery. Once the baby has been delivered, you can now call out the time of birth. Baby girls out, 7:30 a.m. Place the baby in the linen just in top of the mother and proceed to perform the first step, which is the immediate and thorough drying of the newborn for at least 30 seconds. It stimulates the baby to breathe. So the first thing we need to wipe is the newborn's face, head, trunk, and extremities. So while doing this, we want to also perform a quick assessment of the baby's breathing. Ensure not to wipe the vernix off because this provides an extra protective covering to the baby. Actually, this is also serves as a natural moisturizer for the baby's skin, not to get dry. After drying the baby, we can now remove the wet cloth. So the next thing we want to do is to place the baby in prone position on the mother's chest to initiate skin-to-skin contact. To further prevent heat loss, we can now put the bonnet and cover the baby's back using the linen. This does not only provide warmth to the baby, but also stimulates the bond between mother and the baby. It protects the baby from hypoglycemia. Let us remove the first set of gloves.
We can now proceed in cord clamping and cutting.
In cord clamping, remember not to cut and clamp the cord immediately. Wait for the cord pulsation to stop at around 1 to 3 minutes. By doing so, we can prevent anemia and protect our preterms from intraventricular hemorrhage. So once you have noticed that the cord pulsation stops, we can now clamp the cord. Clamp the cord 2 centimeters from the umbilicus and 5 centimeters from the umbilicus. We can now cut the cord near the first clamp. Observe to any oozing blood as that might indicate infection.
Place again the baby back to his mother's chest to promote early breastfeeding.
So at this moment, we can inject the mother with 10 IU of oxytocin intramuscularly to promote uterine contraction and preventing uterine atony. So, we get the medication and get a cotton ball with alcohol.
Mami, inform ko lang po kayo, natuturukan ko po kayo ng oxytocin para po makatulong po ito sa inyo sa pag-contract ng uterus ninyo upang makalabas po ng ang placenta ng maayos.
Okay po, Mami. Pwede ko na po kayong turukan. Pahinga po kayo na malalim. Okay, tutusok ko na po. Okay, good job. We now proceed to the third stage of labor, which is the delivery of placenta. This usually lasts for about 5 to 30 minutes. This is vital because if we don't deliver the placenta, it may cause hemorrhage, or retained placenta may cause infection. In delivering the placenta, we want to ensure to pull it out gently and not forcefully because if we force the placenta out, it might cause uterine inversion, which is life-threatening to the mother. So once the placenta is out, we can now check the perineum, the lower vagina as well as the vulva of the mother for any tears or laceration. We can clean and dry the mother to keep her comfortable. Don't bathe the baby for the first 6 hours to prevent hypoglycemia.
Mami, wag po nating papaliguan si baby sa loob ng 6 na oras pagkatapos niya pong ipinanganak para po maiwasan natin ang pagkakaroon ng hypoglycemia at heat loss.
While she is with her mother, perform eye care procedures and administer vaccine.
Ngayon naman po ay tuturukan ko po si baby ng vitamin K para po maiwasan niya ang tinatawag nating hemorrhage pagkatapos ipanganak ng baby.
Okay, done na. So now, we already complete all the procedures in essential newborn care. Prepare the transfer of the mother and the baby for rooming into the postpartum ward. And that ends our return demonstration of ENC.